So I received a message this morning from one of my RN supervisors that worked for me saying she had her first death. Now, the first thing I asked her was, how are you feeling? It's important that I ask that question. One, because if you haven't experienced that before, it can really bring on some emotional feelings that you might have not had. Okay, death is an awareness. It's an awareness that this life is temporary. Okay, it's an awareness that you need to appreciate the ones that you have in your life. It's a humbling experience when you're pronouncing that person. And I remember vividly throughout my career, I worked at one facility and I just loved, and I mean, I absolutely loved how they went about handling death in their facility. It was so warm, welcoming, and inviting. And I know you might be thinking, like, what the hell? Why would that be like that? And and my thing was how we enter the world, right? We enter the world and we're celebrated, um, you know. But when death happens, and this was years ago when I first started out in long-term care, it was like, oh my gosh, shut the doors, put the residents in the room, you know, the funeral home is coming to get the resident. And I was like, why are we doing that? You know, we need to respect and honor them the same way they came in and the same way they are leaving, right? It's an awareness. Death should not be hidden, okay? But the one facility, I mean, it was such a beautiful experience, and I really appreciated them, how they performed, um, what they performed when someone has passed on, as a level of respect, a level of dignity for these residents. And you know, when you having someone that passed away, you know, like I said, it's a humbling in this experience, and you know, you want to make sure that you know, they are still in being in a dignified, respected in a dignified manner, you know. So I was grateful that she reached out to me, because one of the things that I love being in my position is the relationships that I have with my employees, or the relationships that I have with people who I encounter, you know, to for them to even tell me like this is what they have experienced, and you know, to still be there as that support person. But once, you know, she said she was, you know, okay, I just wanted to tap into a couple of things that I feel like is important that you need to know as the RN in the building, who may have to pronounce. One, make sure you know your nurse license. All right, I run into so many nurses and they like, oh, I don't know my nurse license. Okay, it's important that you know your nurse license number, because those are, you have to put that on that death certificate when that person passes away. You need to make sure you call the doctor, because you need to get orders to pronounce. You want to make sure you contact administration, because they need to know that, you know, someone has passed on. As I stated in the previous video, you need to be aware if you need to call a coroner in your county, your state, whatever it is, because different states and counties function differently. If in the event it's an unexpected death, then yes, you're going to be notifying the coroners, and that could be, you know, say if you have a code and you know the person passes away, or if you have a fall with an injury and the person passes away there, then those are like unexpected deaths that you will have to notify the coroner for. The other thing is notifying the funeral home of the passing of that resident, and paying attention to items that you send with that resident, such as if they have glasses, if they have dentures, if they have like any type of jewelry on. And you want to make sure that you document all of that on their personal belongings sheet, as well as in, you know, the information that you're sending to the funeral home and in your nurse's note. Okay, so I wanted to share that information. You know, one, death and long-term care, or in the healthcare setting, it's a reminder. Okay, it's a humbling experience. You know, so like I said, it can bring about some feelings that you might not have had, but as the nurse leading in that facility, make sure you know your nurse's license, and make sure you follow whatever process that facility has. If the facility doesn't have one, or you are not able to locate it, in the event you might be agency, be sure that you know your nurse's license, you fill out the death certificate, your portion of it, and notify the appropriate authorities. All right, so follow me for more tips.